Go to the ER or after you have surgery, who is the one that's always there to keep you comfort? There are millions of nurses all over the world that work day in and day out to make sure your lives are easier when you go to the doctors. According to the Health Resources and Services Administration Bureau of Health Professions, growth in the nursing workforce outpaced the growth in America. This growth population in America. This was in 2013. So obviously there are many, many different positions that someone can acquire when becoming a nurse. And it's good to know how they became certified and why they can help you. So I am a pre-nursing major, so I've been researching about these positions for about a year now, so I'm quite knowledgeable about them. There's about 10 different positions that someone can get, but today I'll be talking about the 3 most popular ones. First, I'm going to talk about CNAs, and then I'll be talking about the LVNs and LPNs, and then lastly, I'll be talking about the RNs. So beginning with the CNAs, which is a Certified Nursing Assistant. So they get a lot of experience working with patients. So it looks really good in your nursing application if you want to apply to be an RN, which is what I'll talk about later. And basically anyone in this room can be a CNA. It takes 6 to 8 weeks, and the only requirement is basically to know English, really. And what they teach you is CPR and just basic nursing care. It's not really that complex because it is only 6 to 8 weeks. And so once you get certified, you take the proper testing, and the trainers observe you. You can feed the patients, you can clothe, you can bathe them, move them from the wheelchair to the bed or anywhere they need to go. They're just the assistants. They're more hands-on. They don't administer medication or anything like that. They work under the RNs and the LVNs. And they make about $24,000, but really depends how long they've been working. So I thought that was interesting over there. Behind every great nurse, there is a running CNA, which is true because they're their assistants, so they're always running around doing what they say. So next is the LVNs, which is a licensed vocational nurse, and an LPN, which is a licensed practical nurse. And they're basically the same thing. I've researched what they both do, and they make the same amount of money. They do the same job. So what an LVN, I'm just going to say LVN, but I mean both. So what they need to do is get an associate's degree in nursing, which takes about a year and a half. So they're a bit more complex than the CNAs. So they're one step above them. What they learn is biology, nursing, pharmacology, and so once they become certified, they help the RNs a lot. They help them perform tests, take samples, they do fluid input and output, and they do everything that the CNAs can do. And sometimes the LVNs are just as, good as the RNs, which is the ones that are above them. Heather Young from the Gerontologist publication, so she's from the University of Melbourne. In 2008, she said, limited evidence suggests inconsistent differences between RN and LPN delegation authority and or supervisory practices in nursing homes. So LVNs, even though they're below the RNs, they do a lot of what they do, and that's why a lot of LVNs go back to school and become RNs because they make more money. And speed of money, this is how much they make in California. There's $51,000, but it really depends on how long they've been working. So lastly, I'll be talking about the RNs, which is a registered nurse, and it's quite difficult to be an RN. First, you have to get your GEs, just like any major, and they really look at your sciences. You have to do really good in your sciences. So then after you do your GEs, you apply to the program, and that's the hard part. It's very, very competitive. Like here in Casa LA, out of 600 applicants, they only accept 60. So, and that's how it is everywhere. So you have to really dedicate yourself. So after you get in, you don't have the life for the next 2 or 3 years. That's what I hear. It's very rigorous. You work in the hospital, you do your clinicals, which is when you pretty much shadow the RNs and you do what they do. And also in the classroom, you learn how to administer medication, you learn biology, how the cells work, how the body functions. You learn math because you need to know how much medication goes into your patients. You don't want to kill them. And once you become certified, when you take the proper testing, you do treatment plans, you do acute care, case management, you treat the patient's wounds, you educate the patient's family on what's going on with their family member, and they do a lot, and they do everything that the LVNs do or the CNAs do, and they know more about the patient than the doctor does. Alex Boom from the Australian Nursing and Midwifery Journal this year, he said that nurses spend so much time with the patients that they're often in a better position than doctors to know how patients are really coping with often highly toxic, technically life-prolonging treatments. So yes, doctors, they're obviously certified to know how the patient's body is functioning, but the nurses are the ones that are there 24/7. They know how they're doing, how their treatment is working. And they make about 70,000, give or take. Some make up to 90 because they've been working forever. So yes, in conclusion, I hope now that I've gone through my presentation, y'all have a better understanding of how nurses are, how versatile they are. First I talked about the CNAs and the LVNs and LPNs, and lastly the RNs, and how they became certified and what they can do. And really many people take nurses for granted. You know, people think they just clean their poop or something, but they do a lot more than that. You know, they save lives and they better